Okay, are we live now? Okay. Testing. Why is this not? It's not. Okay. All right, I'm going to have to project because apparently my mic is dead. I don't know why. Okay, so I'm just going to project. Technical difficulties.
Okay, yep, she can see you now.
Okay. Caitlin, can you hear me? Let me know if you can hear me. Go ahead.
That's what I just said. Can you hear
Yeah,
her?
can you hear? Because my mic is dead, unfortunately.
I can hear her. Yep,
Okay.
you're good.
All right. So let me, real quick, I'm going to put this on charge while we're, just take it out of that tablet and plug it in.
Oh, this?
Yeah, the cord, please. Okay. So what we need to understand about nutrition is what we're doing with our patients is going to matter. So if we have somebody who's diabetic, we want to try to encourage healthier eating. If we have somebody that has no salt added, we want to make sure we're selecting snacks that aren't high in sodium. If we have somebody who is on a low protein diet, which a lot of times happens with kidney disease, we want to make sure that we're helping them with snacks that don't have a lot of protein. So no cheese, no peanut butter, no fish, no tuna, no eggs, lower protein. Okay.
Now the sodium, that's also, is that Gatorade too?
Gatorade has sodium, yes.
Right? Okay.
Yes.
So anything like, is it electrolytes that?
So sodium is an electrolyte.
Okay.
Sodium, potassium, chloride,
So
all
if
of
you're like in a
those.
family, in a house setting, and the family says, oh, he needs his Gatorade today. Tell the nurse.
Right. Right. If they're on a low sodium diet and they're drinking Gatorade, the nurse needs to know. Now that may be perfectly okay. That may be the only sodium that they're getting because we do need to maintain a balance. So it may be perfectly okay for that patient. It depends on the severity of disease. It depends on what else they eat in their daily diet. There's a lot of factors there, and that's why we need the nurse to go through the patient education, and sometimes we'll get a dietitian involved too. All right, any other questions on chapters 8 and 9? Anything I can explain for you? No? One class left, guys. That's it. We're doing our last 3 skills today. You will have a lot of practice time left in class today. But this is it. This is the end. Wednesday, please bring your book back, your yellow book back to class. Wednesday, we're going to go over how to renew, what continuing education is, and how to get it. I'm going to be talking about how to find a job in healthcare because it's different than other industries. A lot of people don't realize that. We're going to explain why it's different. We're going to talk about how to answer that question. Tell me a little bit about yourself during an interview. I actually have a formula for you to use. And I'm going to go through that in class with you and help you identify your formula. Okay, good. We're going to talk about what to expect on the test, all of those types of content. So Wednesday, we still have a lot to cover, but it's not skills-based. Today is going to be our last skills day. And today, we're going to learn things that are kind of repeats of what we've learned before. It's super easy.
If I want to keep this book, how much is it?
For $42, if you want to buy it from me.
Okay.
Do you have the internet?
I do, but I'm old school. I read it from the book.
Well, no, what I'm going to tell you is if you buy it from someone else other than me on the internet, you'll get it a whole lot cheaper.
Oh, don't worry about it.
So
I can pay
it is cheaper if you go to the other place.
That's okay. I'd rather buy from you.
Oh, thank
need
you.
to make money.
Thank you. Yeah, from us it's 42. All right. Oh, the game show I'll be doing in not this coming Tuesday, but the following one. Okay. So not tomorrow, but next Tuesday we'll have another episode of the game show. I go through 15 questions on the game show, and it's live, and I've got to get you. Do not leave without your do not leave without your prize. So it's live, it's interactive. You actually answer the question as I'm giving it. If you answer it right, you get points. You go on a leaderboard, and then you can win prizes. So it's a really fun way to prepare for the written exam. And the questions are very similar to what you're going to find on the state exam. I don't use I write new questions every single week for that. Very similar to what you'll have on the state exam. All right, so let's get into today's skills. So go to page 80 in your book. And we're going to learn another range of motion. So while we're turning, hold on one second, because I want to tell you guys about something super exciting that I just did, but I got to type it in. You're fine. Okay. So let me talk to you about this. This is pretty cool. I just got this done last night. I mean, I have been pushing really hard to get this done. This is, so, you know when you go, you guys all had to buy scrubs to come to class, right? Or you purchased them before. But you know when you walk into a scrub shop and you see all of these options, you have no idea what to get? It's like, where do I start? I have no idea. I just want scrubs. And I hear that a lot in the store. People will come in and they'll say, well, I want Cherokee. Okay, 90% of the store is Cherokee. We got to narrow it down a little bit. You know, are you looking for elastic waist, straight leg, jogger? Do you want tops that are fitted or some that are a little bit more baggy? What are you looking for? We can't help you if you don't know what you want. So I created a quiz to help you with this. This quiz takes less than 2 minutes. You go through, you click on, I give you options, you click on the option, and at the end it gives you 3 styles that meet your criteria exactly out of 160 potential options. It's going to tell you the 3 that are exactly what you are looking for. So then you can go into your scrub shop and say, hey, I need this, this, and this. Show me. And then you try them on and figure out which one is going to fit you the best. Okay? So I need beta testers. It's live, but I need beta testers for this. So if you guys could, sometime in the next day or two, go on to cherokee-scrubs.com/quiz. If you go on there and take the quiz, let me know what you think about it. Was it easy to use? Was it informative? Did you like it? Would you use it? And it actually has links that you can click on that'll send you to be able to see the item and order it if you want to. So it's pretty cool.
It's actually really cool and really easy. She's not giving herself near enough credit, y'all. I'm not even kidding you. This woman has put immense time and energy in this app to make it what it is.
Yeah, I'm trying to make life easier for you guys.
Yeah.
I really am. With everything I create.
And for me too.
Yes. It's going to help. She's actually the reason I created it, because she went into an office and she's like, I don't know what to show them. And I said, well, let me just put something together for you real quick. Yeah, that was 3 weeks ago.
Yeah.
I've spent every waking minute on this thing since then.
Yeah.
So, so it's her fault.
All my fault.
Can you take that down for me,
I
please?
can.
Okay. So let's get into our skills today. So range of motion. We already know how to do range of motion. We've talked about range of motion twice before. We went over range of motion of the shoulder And we went over range of motion of the elbow and wrist. This is nothing new for us. We already know what to do here. But this time, we're going to do range of motion of the hip, knee, and ankle. So we always start with a care plan because that's our recipe. And if you look at the care plan at the top of the page here, it tells you to provide the following range of motion exercise to the resident's right hip, knee, and ankle. Flexion, extension. That's it. That's what we're doing. One exercise. Flexion, extension. We're going to do it on the hip and knee, and we're going to do it on the ankle. It tells us, please provide 3 repetitions of each exercise, and the resident is not able to help with the exercises. So, what body part are we going to work on?
Right, hip and knee and ankle.
Okay, so we're going to do both?
No, the right side,
Why?
because that's what the care plan says.
Care plan said, absolutely. So when you get to the test, what are you going to be asking for? Care plan. Where's my care plan? I want my care plan. Where's my care plan? Care plan. And once you get your care plan, you're simply going to follow it. How do you follow it? Well, the principles tell you how to do the skill. Care plan tells you what to do. The principles tell you how to do it. Okay? So our principles, let me go back here. Our principles for this skill is to follow the care plan, to do our opening, evaluate if we need gloves. We're going to do the range of motion principles, we'll talk about in a minute, and do closing. So there's nothing new here to teach you. This is all stuff we already know. But the hip really is a 2-for-1 exercise. 2-for-1 exercise. When your patient is laying down and you bend their knee and bring it up toward their chest like this, you're actually bending the hip and the knee at the same time. So 2 exercises for 1 motion. This is important because if you try to do a straight leg raise without bending that knee, it's going to pull the sciatic nerve, which runs from the low back all the way to the bottom of the foot. It pulls it taut when you raise that leg up. It makes it really tight. And a lot of older individuals or people with injuries can't tolerate that because it hurts. So we don't do straight leg raises for range of motion. We bend the knee at the same time. And that relieves that pressure. It keeps that nerve from having to go so rigid, get stretched so thin that it causes pain. We don't want to cause pain. We don't like pain. So the hip is a 2-for-1 exercise. Let me just get this out of the way. All right. Good? The ankle, we're just going to put the foot up and back. So we're going to push the foot forward like they're stepping on a gas pedal and then back toward the head. They're going to feel a little stretch along the back of their leg. So that's all we're going to do. But if we're kind of flexing that foot forward and then back to the head, right, that's going to cause the heel to do this on the sheet. And that causes friction. We don't want friction. So we're going to lift that ankle up off the bed a little bit so that when we flex the foot forward and then back, that heel isn't contacting the bed. So we want to support from underneath. We're always going to follow that care plan. Remember, the care plan is going to tell us which body part, which exercises, and the number of repetitions. We just follow the recipe. That's all we have to do here. Remember that every skill starts with an opening, and every opening starts with a knock. You guys understand when you go take the test, you're going to hear my voice in your head. You will hear that. You're going to get to the test, you're going to read your care plan, and you're immediately going to blank out. You're going to forget everything that you learned because you're being tested and the spotlight is on you and now it's go time. And you're going to blank out. You are going to hear in my head every skill starts with, and your brain is going to go, the opening. And then my voice is going to say every opening starts with, and your brain is going to go, a knock. You now know where to start. And then once you start, that's the hardest part. Once you have that starting point, you can roll from there. But you've got to have a defined place to start. And that's why I do this over and over and over and over. Because when you get to the test, your brain is going to turn off. I know it will. I have been doing this for years. I know exactly what's going to happen. And you're going to hear my voice in your brain saying every skill starts with an opening, every opening starts with a knock, and you're going to know where to start. I know this because I've had thousands of students that came back and told me this saved their test because they did not know where to start. And they'll tell me, I heard your voice in my head. And you don't need to be sitting in this classroom to hear my voice in your head. I have hundreds of thousands of people that have watched my videos and put comments on my videos. I heard your voice in my head, right? So I'm drilling this into you for a reason. I know to you it seems very repetitive and like, oh yes, I know, we've done this before. Every class you say the same thing on purpose. You're right, I do, on purpose. Because I am trying to train you for that one moment in time when your brain is no longer active. Okay?
It might be, anyway, when we take the test, when they test us after we're done with the computer test or before, when we do the skills test, is it in a room like this?
Yes,
A small little room?
small room.
Just the testers and me?
And the other testing candidate. There's only 4 people in the room, 2 evaluators and 2 testing students. One that's performing the skill, one that's the patient.
So it's not like we're gonna be in front of a crowd.
No,
It's just the 4 of us?
just the 4 of you in the room.
Knock, knock, knock. Thank you.
Yep. Very private testing experience.
So everything's in that room.
Everything is in that room.
All 3, it's basically the 3,
The 3 skills.
we do them right there.
Yep.
Get them done and over with.
Right.
And then the next person, the
They
patient.
the patient becomes the tester or tested party, and you become the patient for them.
Thank you.
Now you want to treat each one of those skills like it's a different patient encounter. Same patient, but different patient encounter. Which means for skill 1, hi Ms. Jones, my name is Patti, I'm your CNA today, I'm here to whatever, is that okay? Pull curtain, wash hands, get supplies, do skill, do my closing, wash my hands, my skill is done. Skill number 2, hi Ms. Jones, you're gonna do your opening, skill, closing, opening, skill, closing, opening, skill, closing.
So we got a total of 3 skills.
3 skills, yep.
Skill, 1 after 1.
One after each other, yep. And you have to end one skill before you move to the next. So if you don't say, I'm done, I'm finished, my task is complete, my skill, if you don't indicate that, they will not let you go to your next skill. They're going to tell you, stop, you have to indicate you're done. But the reason for that is that you can make corrections up until you declare that your skill is done. That way they don't get into a situation where people say, oh yeah, I would have made a correction, but she told me that my skill was over. No, you declare your skill is over. And then you can't make any corrections beyond that point. So don't be in a rush. Think about your skill. Yeah, you're going to be nervous. You're going to want to get it done. Absolutely. But you want to think about this. Because remember, if you forgot something and you make a correction, it can save your score. So think about it. Don't rush through it. If I were testing, I would go back and read that care plan one more time before I ended my skill. Just to make sure.
Even if you have like the 4 minutes, you're sure you're at the time.
Oh yeah, because hand washing is graded separately. So let me take you to this real quick. Go to page 71. Let's do this activity together. All right, there is a formula they use for testing. And when you're taking your test, they're going to give you your care plan. 7-1. They're going to give you your care plan set that has all 3 skills listed, right? And they're going to tell you you have 33 minutes to do this set of skills. Or you have 31 minutes to do this set of skills. Or you have 37 minutes to do this set of skills. Now, each skill that we've gone over, go back here. Okay, so each skill we've gone over, you've seen a page that looks like this with the principles for that skill. And at the bottom, you have the time for that particular skill, right? But the timing is graded as an aggregate. So all 3 together. But they also give you extra time. So let me explain how this works. Give me a number 1 to 11.
6.
6, okay. So the computer randomly picked skill set 6 for me to perform. This is my skill set. The computer picks your skill set. The evaluator does not. The computer does. Now the reason for that is to help prevent bias. And maybe you parked in their parking spot this morning and they're mad at you. You don't want them to be able to give you the hardest set of skills there is, right? So the computer picks this, and it picks when you register. It doesn't pick the day up. It's actually coded in your Prometric ID. So you have skill set 6. The evaluator is going to read this to you. So skill set 6 is to perform passive range of motion to shoulder, provide catheter care to a resident with an indwelling urinary catheter, which we're going to learn in a few minutes, and measure and record the contents of the urinary drainage bag, which is the last skill we're going to learn. Okay, so those are the 3 skills that we're going to do. So let's figure out how much time we would have to do this skill set. So on page 71, you see a little chart that has the time for every skill that we do. Look up range of motion. How much time would we have to do range of motion?
8 minutes.
4.
Oh, nice little.
Should be before. Yeah, it should be before though.
Never mind.
Yeah, not behind. So 4 minutes, okay? Catheter care. How much time would you have to perform catheter care?
15.
15 minutes. Good? Is it 15? Okay. And how much time would you have to empty the drainage bag? 9. So if we add up 15 plus 4 is 19, plus 9 is 28 minutes. Good so far? But they're also going to give us an extra 3 minutes for hand washing. That doesn't count in our skill time. 3 minutes for hand washing. So let's add 3 to 28. Now we have 31. And then they're going to give you 5 minutes for thinking. They call it transition time in between the skills. Think about your skills. So an extra 5 minutes. So we had 31. We're going to add 5 to that. So for this care plan set, we would have a total of 36 minutes to do these 3 skills. So yeah, you do have time to go back and look at your care plan at the end of each skill. That's what that 5 minutes is there for. Okay, does that answer your question? My students do not time out. You just don't. Because you got a clue. You kind of understand what's expected here. The people that time out are the ones that have no clue at all. Let me give you an example. You guys remember partial bed math? Right? So right now, and I love this point of the class, right now you guys are so focused in on all those steps, right? You're like, oh my gosh, if I don't remember to do this, if I don't remember to do that, right? You're focused in on the steps. Let me explain to you how you would fail partial bed bath, okay? So here is an example of something that really happened during a testing process. Candidate was assigned to do partial bed bath. They walk into the room, they look at the patient. Okay. They go over. Where is it? And they grabbed a hand wipe. And they walked over to the patient and they wiped off their face and wiped off like the chest of their body, threw the hand wipe away, put the sheet back up and said, okay, I'm done. That's how you fail partial bed bath. What was wrong with that?
Everything.
Was there an opening? Remember that half of your skill checkpoints is the opening and the closing. Half of every skill checkpoint. Remember? I got a mess over here, man. I'll just pull two at random. These are just two random, right? Look at all that green and red. All that green and red. Look at all that green and red. Green is your opening, red is your closing. Don't believe me? Let's turn it over. Look at all that green and red. Half of your skill, guys, half of what these are the actual grading checklists. This is the actual checklist. Half of what you're being graded on is the opening and the closing. So when that person went in and they just grabbed a hand wipe and started wiping, they didn't do their opening. They didn't do their closing, which means they didn't get credit for any of those. Like half of their skill, not even there. And then they didn't follow the care plan. Remember, our care plan told us exactly what to wash. Face, neck, chest, side, one arm and hand, and back. Told us exactly what to wash. They didn't do that. They uncovered the patient and left them kind of out there hanging out and then covered them with a sheet at the end. They didn't address privacy. They didn't wear gloves, which were around wet body openings. So they didn't do anything. You're right. But I'm looking at it from the checkpoint aspect. There was nothing there to check off. Does that make sense? The way you have been taught to do the skills, it won't even cross your mind to do something that boneheaded. Right? You're worried about missing a step in the opening. This guy didn't even know the opening. Big difference in testing. Chances are the evaluators are going to look at you and go, yeah, I know where you went. Yeah. Now, what's really funny is that you guys will actually kind of be a celebrity in your testing center. You will. And I hear this all the time from students. Because when they find out that you actually went to this class, because most people have watched my videos. Most schools use my videos in their training. Almost every CNA school uses my videos in their training. So these people that you're testing with have seen me often. And when they find out that you were actually here in this classroom, because most of those people don't know that we're right here in Spring Hill. So when they find out that you went to this classroom with me in the flesh, you'll get like celebrity status. Wow. So yeah, it's kind of funny. Don't make friends on testing day. Don't teach anybody how to do anything because this is not the place to teach. Once you're certified, go out there and show the world. Guys, we need better CNAs out there. And the only way that's going to happen is by your example. So don't let them corrupt you. You need to be corrupting them in the best possible way. Anybody see the Netflix special, Take Care of Maya?
Yes.
Oh my. Yeah, we could have a whole class session on that.
Could make me cry.
Yeah.
So what is the name of it? I wanna watch.
Take care of Maya.
Oh.
It was just a huge lawsuit.
Yeah. Yeah, hundreds of millions of dollars. Hundreds of millions, and that's what caught my attention.
Can you like sum it up? Cause I've never seen it.
It just happened,
Yeah.
literally,
Yeah,
Based
The
on that.
verdict just came in this week, correct?
yeah, this week,
Yeah.
yeah.
last week.
Hundreds of millions of dollars. But basically, it was a hospital system and many people within the system that overstepped their bounds and thought that they knew more about what was better. They let logic and reason cloud and remove the humanity from what they were doing. And they locked a little girl away and accused her mother of horrible, horrible things to the point that her mom ultimately, I don't want to say what happened to the mom, but made a very, very unfortunate choice because she didn't feel like she had no other choices. And it was a direct result of healthcare professionals forgetting about the humanity of what we are supposed to be doing. That's why I do what I do, is to remind healthcare that we don't always have the answers.
Right.
That it's up to us to remember that these are people. That above all, if you don't remember anything else in this class, please remember it is always all about the patient. If you remember nothing else that I have trained you, if that's the only thing you take out of here, it will still make you a better healthcare professional than the majority of the ones out there.
Amen.
That's why I do what I do, and I get very passionate about it because I've been on the receiving end of improper, poorly delivered, no care in healthcare. And we've got to do better. That's why I do what I do. Okay. So, every scale starts with the opening, and every opening starts with a knock. So when you're in the test and you can't remember what do I do first, this should immediately flash in your mind. And if you notice, all the graphics that I'm making are very simple and to the point. You'll see this in your brain because I've shown you the same graphic now every single class for this banner.
Do we immediately follow the other student? Or is there a,
There will be a brief break
okay,
as the evaluators switch over from one set of grading papers to another
okay,
and give the second person their care plan set and read it to them. And then once they see and read their care plan set, they will determine when they are ready to start their test.
you stay in the room?
Unless you follow the evaluator's directions.
Okay.
Yeah.
So you can be in there a good little bit for them,
Yes.
that's why it takes all day.
Right, and remember I told you that group 1 is gonna go in immediately. But group 2 has about 45 minutes to an hour to kill, right? So don't go far, but you don't have to wait in the waiting room. Group 2 has about 2.5 hours to kill. Then go get, coffee or go to their car and study or whatever. Group 3, Target shopping, clearance shopping, because you got about, close to 3 hours.
Yeah.
So it's all because each person is going to have a minimum of 30 minutes to do their skill sets. Now, most of the time, you're not going to take all 30 minutes. Most of the time, it's way quicker than that, which is why they give you a range. Good. All right, so we got to evaluate if we need gloves. Now, for the test, this person's going to be fully clothed. Like, you guys are all planning on showing up to the test fully clothed, right? I hope.
Do we show up in our scrubs or?
You can wear whatever you want. You can wear scrubs. The only dress code requirement is closed-toed shoes. That's it. It's the only dress code requirement they have. You want to show up in overalls and a, cowboy hat, go for it. As long as you have closed-toed shoes, they're not going to turn you away. I've seen people test in tank tops and cutoffs. I don't recommend it, but there's no dress code required. Now, I think there is something to look the part, act the part. And I think that subconsciously, whether they realize it or not, the evaluators are going to judge you differently if you look professional than if you don't. They're not supposed to, but humans are human. We're not robots. And I think that that's going to have a subconscious effect on the evaluators. So my suggestion is that you test in scrubs. But if you don't want to test in scrubs, if you want to test in regular clothing, you are free to do so.
And we might feel a little bit more professional if we came in our scrubs too.
I think you will. Absolutely. I think you will. But you will see a wide variety of options. Okay. So this person is fully clothed. They're holding on to all of their own body fluids like a champ. You're not near any wounds, rashes, sores, or incisions. So for the test, are you going to need gloves to do this skill? No, most likely not. In a clinical setting, if your patient is wearing nothing but a hospital gown and nothing underneath, yeah, I'd probably slip on a pair of gloves because even though our hand is under the knee, it's still a little close to south of the border. So we want to make sure that we're not giving our patients the wrong impression. Skin to skin contact, well, anywhere below the belt can feel a bit intrusive. So we have to think about this from our patient's point of view. Okay. Always support the joints from below with a flat palm. We've talked about this. Right? Always support from below. We're not the claw machine at Walmart. We don't lift like this. That's a principle. We're going to move slowly and always return to start. We've talked about this too with the other two range of motions that we've learned. Remember that flexion extension is up down and abduction adduction is side to side and rotation is around. This is just a review because for this skill we're just doing flexion extension, just up down. We want to ask about pain, look for signs of pain. What do we do if we find pain?
Tell the nurse.
Tell the nurse. Yeah, go below the level of pain for the next couple rounds and report to the nurse. And then, of course, we have the 8 C's of the closing. Make sure your patient's in a clean and safe environment. Ask if they're comfortable. Make sure they're covered appropriately if they're in bed. Close or open the curtain, give them the call light, clean your hands. This does not require charting, so we get to skip the last 2. All right, so I'm going to show you this skill. I need a volunteer, so I'm going to come lay down in the bed for me. Anybody? I can show you the video if you want. I have a video. All right.
Thank you.
Thank you. All right, so I'm going to pretend this is skill 2 for the day. I'm just going to simulate hand washing for the sake of time so we can get through this and I can get you guys some practice time. Hi, Miss Jones. My name is Patti. I'm your CNA today. How are you today? Fantastic. I need to do some exercises on your leg. Is that okay? I'm going to close your curtain. Let me go wash my hands, get my supplies, and I'll be right back. I have clean hands. So I'm going to come over here because it tells me to do exercise on my patient's right leg. So I've got to make sure I'm on the correct side. This is her right. Ms. Jones, I'm going to do all the work. All you have to do is let me know if there's any pain or discomfort as we do this, okay? First thing I'm going to do is lift your leg up, bend your knee to your chest, and back down to the bed, and we're going to do this 3 times. So I'm going to lift below the knee and below the heel, and we're going to go up and all the way back down to the bed. Remember to always return to start. Feel okay? Yes. Up, all the way back down. One more. Up, all the way back down. Feel okay? Any pain or discomfort? No. Okay, now I'm gonna lift your leg off the bed just a little bit, and we're gonna bend your foot forward like you're stepping on the gas pedal, and then back towards your head, you'll feel a little stretch. Let me know if there's any pain. So I'm lifting from below, forward, and back. Feel okay?
Yes.
Forward, and back. Any pain?
No.
Forward, and back. Good?
Yes.
Any pain or discomfort?
No.
Are you comfortable?
Yes.
Can I get your magazine before I go? Okay, call lights right here. If you need anything at all, let me know. Environment is clean, patient is safe, and in the center of the bed, covered with clothing. Open the curtain. I've washed my hands. I'll think about the steps of my skill, make any corrections. My skill is done.
And they start timing you the minute you say you're ready, or do you say ready, or how does that?
When they give you your care plan set, they're going to give you. Focus here. They're going to give you a few minutes to go over the care plan, think about it. When you're ready to start the skill, you're going to say, I'm ready. And that's when the timer begins.
Do we get points taken off if we go after like the minutes they tell us we have?
Okay, let's talk about that. So make sure, and I do want to talk about this, make sure you take a deep breath before you say, I'm ready. Okay? That does help. I don't know why, but it does help. So the question is, what happens if you go over? It's not an automatic fail. Okay? So we had, with the skill set that we had 36 minutes, right? You guys remember that? 36 minutes to do the skill set we were talking about? So as you're doing the skill, they're going to check off the points that you did. Right? Everything you did gets a check mark. 5 minutes before your test is scheduled to end, they're going to give you a 5-minute warning. So you want to get as many checkpoints in as possible. Remember that half of the skill over here is red. Right? What is red? Closing. I can do the closing in like 30 seconds. Thank you very much, Miss Jones. Is there anything else I can get for you? Are you comfortable? Environment's clean. Here's your call light. Let me open the curtain. Go wash my hands. Do I need to chart? I need to chart. Let me wash my hands again. Skill is done. I mean, I can do it quick. And now I just got all of those checkpoints. So when they give you that 5-minute warning, you need to go on supersonic speed, right? Get as many checkpoints in as you can. But it's not an automatic fail. You just don't get credit for anything without a check mark. That's it. So don't be afraid of going over. Like I said, for you guys, it's almost impossible for you to go over unless you've restarted each skill 10 times. Okay, you're slow. Yes, you're supposed to be slow. You're new. You're slow. But you won't time out. But if they give you that 5-minute warning, make sure you're getting as many checkpoints in as you can.
When we're doing the skill at the test, you're doing this fake hand washing.
Okay.
We do that
So
there?
let me talk to you about simulations. So during the test, during your first skill on the test, you're physically washing your hands. You're doing your opening, going to the sink, turning the water on, wetting your hands, getting some soap, rubbing all areas for how long? At least 20 seconds. Then doing your nails. Remember, 20 seconds does not include nails. And then circle your nails. And then rinsing, drying, and then getting a clean, dry paper towel to turn the faucet off. Do your skill.
Let them see that.
Because they're grading it.
Yeah.
At the end of the first skill, you're all done doing your closing. Thank you very much, Ms. Jones. Is there anything else I can get for you? Here's your call light. Do you need a magazine? Are you comfortable? All of that. Open curtain, and you're going to go to the sink, turn the water on, wet your hands, get your soap, rub for at least 20 seconds, yada, right? After your first skill is over, at some point, they're going to tell you you can simulate hand washing. Simulate just means say. You don't have to pantomime. You don't have to go to the sink. You can literally say, I'm washing my hands here. Okay? So it's
Wait
a
for their
time,
permission.
right, it's a time-saving initiative for the test. And that's why I'm showing you how to simulate,
But wait for their
but
permission
wait
to
for,
simulate.
yes.
Okay.
Because if you made a mistake on one of your hand washings, they may grade a hand washing during skill 2 instead.
That's good. I watched a video this last week for the pedicure, and I see that you wash your hands, but it's an old video. Maybe you already have a better one. And then when you came for washing your hands, you move the table where you put. So if you touch the table, supposed to wash your hands again.
No, there's no way of keeping your hands 100% clean
Ah,
in a patient environment. I mean, there's cooties all over the place.
okay.
So what you're trying to do, let me explain in a way that might make a little more sense, okay? There's your cooties and then there's everybody else's cooties,
Okay.
okay? So your cooties aren't a danger to you because they're yours. Make sense? But her cooties are a danger to you. You don't want her cooties because you don't know what her cooties are. So there's a difference between your cooties and everybody else's cooties. What we're trying to do when we're working with patients is limit their exposure to everybody else's cooties.
So once a patient leaves the hospital, some people come over and they kind of sterilize the table and everything.
Yes, housekeeping will come and ready the room, but they're not sterilizing. That word is used a lot in our society, and it doesn't mean what you think it does. They're going to disinfect, but not sterilize. Sterilize means a total absence of all pathogens. We can't do that in a clinical setting. It's impossible. Disinfecting, we're going to remove as many pathogens as we can, but we're not getting into, like, I'm not disassembling this table and getting into the screw holes, right? That's sterilizing. Disinfecting is I'm just going to wipe off the surfaces that other people might touch. Okay, so they go in and they disinfect and get ready for another patient, but it's not what you think it is. It's a surface clean. But we're not, this bed doesn't get disassembled. It just gets wiped down. The curtain doesn't get taken down and laundered, it gets sprayed. These bedside tables don't get put into a sterilizing machine.
So, for example, during the exam, the test, if I wash my hands and I come and I touch the bed, it doesn't mean that, like the bed frame, doesn't mean I have to go back and wash my hands again. Okay. This is what I want to understand.
Yeah, you're thinking a sterile environment. There is no sterility in a clinical environment outside of an operating room. That's it. Now, I'm going to ask you a question just to get your brain thinking a little bit. Okay. Let's say I put you in this bed and I'm going to brush your teeth. I'm going to be in your mouth, right? And I put my gloves on because I know I have to wear gloves. And I touch the table and the bed, and those gloves are going to go into your mouth. Would you be okay with that? Huh?
I'm not gonna open my mouth if I saw it.
Yeah, no, absolutely not.
Well, if you were touching only the hand of the toothbrush, I would not mind at all.
Right.
But if you're going to put your fingers with those gloves in my mouth, then I probably would not let you do. But for example, you grab like this and you brush my teeth. For me, I don't even care if you're wearing gloves or not because you are not even kind of touching me.
I don't know, mine does.
Okay.
My mouth could bleed.
We're still close to your portals of entry. And there's a chance that whatever we're touching can transmit pathogens to you. Okay. So, and I understand where you're coming from, and I appreciate that. I do. But we have to understand that when we're working with patients, We want to try to keep ourselves as clean as possible if we're going to go around any of their open body areas. Okay, so that means that once our hands are clean, we want to limit the amount of areas we touch, like the table
Keep
or
the
the
hands
bed,
clear,
or
like you told us before.
not sterile, but you want to keep them clean as much as possible. Okay, it's not a graded checkpoint, it's a human checkpoint.
Yes, exactly.
Okay,
The first thing the gloves touch the patient.
right, first thing your glove should touch is the patient, which means you should be getting the toothpaste on the toothbrush and the towel on the patient and all of those things before you put your gloves on, just to prevent any contamination. Okay? All right. Let's go ahead and take our break before we get into catheter care, because this is going to take me a little bit of time to go over with you. So let's come back at 20 till 10:40. And hopefully I'll have a mic by then.
There was the other ones too.
What do you do?
Is that what we're gonna have
I've
to
been a
remember?
CNA.
I don't know, that's what
Oh,
I'm
yeah,
asking you, I'm
okay,
wondering,
you're
are we
just,
gonna need, like, if they
like,
say,
redoing
will the
it.
skills say,
Yeah.
place
I
your
worked for hospice
assist your
in Citrus County for
patient
since
into a
2004.
prone position or lateral position, and I'm
That's a good question.
worried, do I need to know what this position is?
Right.
I went into
Because
the
that was only 3 of like 6 or 8 of these, there's a couple more.
Right, yeah.
What's that?
Supine?
Supine.
Supine.
So I got a really easy way to remember the positions.
Okay. That's what we were just
So
So
talking about.
memory memory
different-
tricks, right? And they're wacky, they're crazy, they're whatever, but it helps me remember all of these words. I gotta turn this air off. It's freezing in here, guys.
Cause there's a couple other ones besides the name of that one that we just asked.
Okay, so let me explain this real
Supine.
quick. All right, so let's start with supine. Supine means flat on your back or on your spine. Supine is on your spine. Say laying on your spine. I think they can hear me. I'll
Okay.
just use because this mic
Okay,
is loud.
okay.
So supine is on your spine. Prone is your posterior up, right? PMP. Prone is posterior up. Fowlers. Okay, this one you kind of have to work with me a little bit Okay, because this one's a little bit complex, but let me explain to you how I remember Fowler's. Another name for chicken is fowl. Okay. Another name for chicken is fowl.
How do you spell it?
Fowl.
Ah,
Just like Fowler's, right? Another name for chicken is fowl. What position do you need it to be in to eat fried chicken?
Sitting up.
Sitting up. Fowler's is a sitting up position, full upright position, right? To eat chicken. So Fowler's to eat chicken, sitting upright. Good so far?
Yeah.
So spine is on your spine. Prone is posterior up. Fowler's is sitting up to eat chicken. Now I need fried chicken for lunch. And Sims. So Sims is another position you need to know. So Sims is a name of a popular mattress brand. Okay. This happens to be my sleeping position on my left side with my right knee cocked up. Okay, that's how I sleep, right? That is the Sims position. So Sims is my sleeping position.
Because that could be on the care plan test.
yes, this is
Lateral
So
participation in a lateral position.
let me explain to you a little bit about the test because a lot of people make this mistake. Okay, the test is not technical. The test is not about vocabulary. It's not about medical abbreviations. It's not about positions. The test is not technical. The test is situational. All of the questions are going to be, what are you going to do? They're all situational questions because that's what CNAs do.
even the written test.
I'm talking about the written test, yes.
Well, what about the clinical? Would the care plans tell us what position we have to put them
You
in?
have the care plans. At the top of the page right there, that is the test and care plan.
Okay.
You have the care plans. So no, it doesn't
So, okay.
doesn't have any of that. So a lot of people make the mistake of thinking that the test is highly technical, and they spend all of their time focusing on medical abbreviations and all of the terms and those types of things. That's not what the test is about. The test, in fact, the test plan, give me 2 seconds, all right? Just give me 2 seconds. I'm going to print off the test plan for you so you guys can see. Let me see if that shows it. This is what I use to develop the questions for the game show that I do every other Tuesday. This is exactly what I use to create those questions. This is published. Everybody has access to this. It is not hidden in any way. It is absolutely transparent. But let me print this off for you. I have it saved on my big computer at home. I don't have it saved on this one. So this is 16 and 17. Sorry, slow printer. Bear with me. Speaking of slow printer. Okay. Written test content outline. This complies with the nurse aid assessment in AACP. It's the test plan used nationally for all nurse aid exams. Okay, this is off of that. So I'm going to pass this around so you guys can see it. But this is how your written test is going to be structured. Okay, 20% of it is the role of the nurse aid.
It's 100 questions.
60.
60.
And only 50 of them count. 10 of them are what they call pilot questions, where they're testing them out to see if they're well-written questions to use on a future test. So only 50 of them are going to count. 20% of your test is going to be on the role of the nurse aid.
Okay.
What do we know about the role of the nurse aid?
And we have to get like 70%.
No, it's not like that. They don't grade the written test like that.
Huh.
You have to pass every section. They're not going to tell you the following questions are on the role of the nurse aide, because if they told you that, you'd know how to answer them. For safety, there's only I want to give you the actual.
So
For promotion of safety, there's only 9 questions. So if you miss half of those questions, that's only 4 questions. You've missed half of safety. Does that make you a good CNA?
No.
No. Role of the nurse aide, there's only 7 questions. If you miss 5,
No.
should you be a CNA?
No.
No, because you don't know your role, which means you're going to overstep your bounds, right? So the role of nurse aide, what is that? What kind of questions would they ask us out of that, right? The role of nurse, that sounds like a really big topic. What kind of questions would they ask? Well, personal responsibility, like reporting requirements, promotion of personal health and safety, promotion and protection of residents' rights, time management. Well, we talked about that. Workplace standards, including ethical and unethical behaviors. So you're going to have an ethics question. And the nurse aid registry, which we're going to talk about on Wednesday. It's also going to ask you questions about nurse aid as a member of the healthcare team and communication skills. Those are all going to be under the role of the nurse aid. Promotion of safety. You're going to have 9 questions on that. Promotion of function and health of residents. Now, this is the technical part. It's going to ask you questions about personal care skills, health maintenance and restoration, age-related changes. We've spent a lot of time on that. And psychosocial needs of your residents. You should all be able to answer those types of questions based on the conversations we've had in class and your reading. Basic nursing care provided by the nurse aide. Well, we've been learning that all along. And then the final category is providing specialized care for residents with changes. So Parkinson's, stroke patients, how would we, how is that condition going to affect the care that we provide? Okay.
Can you take a picture of it?
Yeah, you can. I'm going to pass this around. You can take a look at it. But I actually have an easier way because this is written for nurses. It's not really going to help you all that much. I have a free ebook that I created specifically for the written test that breaks this down like everything else I do. It breaks it down and makes it easy. So just go onto my website, foryourcna.com/ebook and download the free. It's free. It's workbook style. Use it. It helps. So I'll pass this around. You have a practice test on page 1. What page is that? 190, 191? 191 in your book. Don't take it yet. Wait until you're done with your reading. But there is a practice test in there that will help you identify whether you're ready for the state exam, the written test. If you miss 5 or fewer on my practice test, you're ready. you're ready. Students tell me that my test is harder than the state test. But if you notice, when you read through those questions, it's all scenarios. It's all scenario questions. That's how they're going to be on the state exam. So they're not going to ask you, identify the term that relates to a patient laying on their left side with their right leg bent in front of them. That's not a test question at all. At all. Okay. Does that make sense?
The answers are here too.
Yes.
Okay, I'm gonna take this test later.
Do your reading. Make sure you finish up chapter 10 first, because there are some questions in there.
Yeah.
Okay, so do your reading. But I'm telling you, you guys, you don't think you're prepared because you have nothing to compare yourself to. I'm telling you that if you were in this class and stayed even reasonably awake, you are more than prepared for the written test. The written test is mainly designed to make sure that you are not going to operate out of your scope of practice and in an unsafe manner that's going to put your patients at risk. That is what the written test is about. It's not about knowing the medical terms. That's not your role. You are not in the patient's medical records. You're not writing orders. You're not reading orders. You're following a care plan to do personal care skills. So the scope of the test has to reflect the scope of your work. Okay, and that's why I wrote the ebook. The ebook is going to lead you through this. Okay, so there's 5 things that you have to know. Know your role. What's the role of a CNA? What does the CNA do?
Follow the care plan.
Yeah, follow the care plan. We do normal. We are responsible for performing ABLs on patients that can't do it for themselves. And what if we can't do those things? Who do we tell?
The nurse.
Okay, know your role. You already know that. You already know that. Know your normals. Now, normals is beyond vital signs, although you do need to know your normal vital signs because we have to report abnormal. If you don't know what normal is, how do you find abnormal, right? Got to know your normal vital signs, but it goes beyond that. Know your normals is also what is normal for aging. We have to know those normal signs of aging so we know what to report. Okay, so know your role, know your normals. Safety is a big part of the written test, safety, because we can't have you out there putting our patients at risk. So safety, how do we test safety? Safety is in the details. The principles cover the details. So if you paid attention to the principles, you'll do fine on safety. Infection control is going to be covered on the written test. Infection control can be summed up in don't let stuff from other people's holes touch things out of your, touch your holes. Okay? Say infection control, that's going to be important. First thing your gloves should touch is the patient. Keep your supplies clean for the patient. Don't lay the dentures down on the sink because that's an infection control, violation. And then the last thing is going to be patient rights. It's our job to promote patient rights. So those are the 5 big things that they're testing you on, and those are all things that we have gone over in detail in the class, every class. You guys are well prepared for the written test. And I know that your past experience with written tests is really messing you up here because a lot of teachers out there have intentionally tried to trick you. That is not what a test is, and shame on all of those instructors for doing that. All they're trying to do is show you that they're more intelligent than you are, and that is not the role of a teacher. I should never be in a position where I make myself sound more intelligent than you on purpose. I should be willing to share my knowledge freely as a teacher. So shame on them for making you doubt your ability to take this test. That's not what this is. That's not the spirit or the intent of the written test. The written test is all about showing that you're capable of staying in your lane and providing safe, effective patient care. Okay? But I write questions for this every 2 weeks. And if you're concerned about the written, tune in to my game show. It will help you. Guys, I have so many resources to help you with every part of this. If you're not in the online course, you're missing out. That online course has hundreds of questions that are all designed to get you ready for the test. You've got everything you need to be successful. You just gotta, it's a lot to put into place. Okay? Good? All right, let's get into catheter care. It's on page 158 of your skills book. All right, so you know everything you need to know to do this skill. There is nothing new to teach you to be able to perform this skill. You know it all. What I have to teach you is what a catheter is. I have to teach you what a catheter is, what it does, and how it's used, because you're probably a little intimidated by catheters. Most people are. And that's, you're intimidated because you just don't understand what they are and how they're used. So that's what we're going to go over here. You already know how to do the skill. We know every skill starts with the opening. Every opening starts with a knock. We know to follow the care plan. We know that if we use supplies, we have to put them somewhere. What are we going to put them on? A barrier. And when do we get the barrier? Yeah, before we get the supplies. We're in the patient's private area. Do we need gloves? Yes. We're going to uncover our patient. So we're going to use a privacy blanket. We're using linen, so we don't want to hold them against our, and we don't want them to touch the, and if we take too many, we, guys, you know this, right? You're like, yes, we've been over it, over and over and over and over and over. Yes, I know. That's the only way I can get you to repeat it to me, but it's going to be important on the test. If we're turning our patient over, what do we have to do before we turn them? Because we always want them to be in the middle of the bed. This is a washing skill. We're going to get water, we're going to check it, they're going to check it. Don't put soap in the basin. Right? We know this. We're going to use the leaves method. Remember that leaves method that we learned with partial bed bath and we did with peri care? We're going to do it again with catheter care. We're going to clean our basin, same way we cleaned everything else, and we're going to end with the closing. Nothing new here. You know all of these principles. There's nothing for me to teach you on how to do this skill other than what the catheter is. So let's go to page 159 and look at the care plan. Remember, this is the care plan from the state exam. If you read through that care plan, does it say anything about the patient being in a prone position? No. They are. Or, I'm sorry, in a supine position? They are. Care plan doesn't say it because that's not your role. Okay? It does tell us to provide catheter care with soap and water to a female resident with an indwelling urinary catheter. Clean the catheter tubing and perineal area only. So what are we cleaning?
Catheter tubing and perineal area only.
Absolutely. We parrot the care plan. We don't make it our own. We don't change it. Just read it and do it. Okay. Remember pericare? Boy, this looks a lot like pericare. I mean, a lot like pericare. The main difference is pericare started with the patient on a chucks, because that chucks was holding urine. Catheter, they aren't going to be on a chucks. They don't need one because we have a tube and a bag that stores the urine. So under them should not be wet. So pericare starts with a patient on a pad and ends with a patient on a pad. Catheter care, we just put the pad under for cleaning and then take it out. Okay? So with pericare, we change the chucks. We clean top to bottom, middle, side, skin fold using the leaves method. We clean the back side, middle, cheek, middle, using the leaves method. And then we change the chucks again. That was pericare. Now, catheter care looks like this, but there's two minor differences here. Two minor differences. The differences being, we're going to put a chucks under the patient. We're going to clean the peri area, middle, side, skin fold, but we're not cleaning the back side, and we're not changing the chucks at the end. We're just taking it out. That's the main difference here. We don't clean the butt, and we're not leaving them on a fresh pad at the end. We are going to clean the tubing, though. So we're going to take out 2 steps and add in 1. So in effect, this is actually a little bit easier than pericare.
I watched this video for the cleaning, for the female. But how we clean a male?
So male pericare is in your book at the end of the pericare. What page is that?
Do you have a video of the male?
No.
No?
No. But we don't need one.
Yeah, they went over it pretty good in the book.
So on page 154.
Of the yellow book.
Oh, they
No,
did.
in the white book, 154. 154. At the end, it talks to you about, on page 154, it says, what about male pericare? And it explains how to do it. Your yellow book has illustrations in chapter, I think it's 7.
Yeah.
Okay. But there's no functional difference. When we're doing male pericare, we simply wash what we see. You hold the penis upright, you start at the top, you go down the shaft, and you clean the scrotum. Whatever you wash, you rinse. Whatever you rinse, you dry. If they're uncircumcised, you retract the foreskin to clean under it as you're cleaning. But we always put everything back where we find it. So put the foreskin back.
That can be very painful
Yes.
for a man. I always put the foreskin back.
Yes. Yes.
That's all I'm gonna say. Extreme pain.
Yeah.
For a man.
I
For
never,
us, we could handle
I
it.
never saw one with skin. So I have no idea how it is, to be honest.
Right,
I should
well-
find a video that I could watch.
Different culture. There are videos, but I can't recommend those. So when it comes to male pericare, there are some that are circumcised and some that are not. Generally speaking, so here's the difference, okay, and this is kind of important. When we do personal care, it's because our patient cannot do it themselves. If the patient can clean themselves, we are not in the neighborhood. Okay, so we only follow the care plan. Care plan will tell us whether we need to be in the neighborhood or not. Male genitalia is up front and easily reachable for our male patients. So for the most part, males will continue to do their own pericare as long as they are physically and mentally able to do so. We do less male pericare than we do female pericare because males are able to clean because everything is out in the open. Female pericare is a little harder for women to do because it's tucked up and under. We do more female pericare than we do male. Okay? And that's why you're having trouble finding videos on it, because it's not as common. You do have graphics in chapter 7 of your yellow book, and you've got instructions in your white book as well. But you just wash what you see. That's it. Okay. All right, so catheter care, very, very similar to pericare. Catheter care is going to be done once per shift. Pericare is done every 2 hours around the clock. Catheter care is only done once per shift, usually at the end of the shift. You're going to clean the catheter tubing and the skin around the catheter tubing, and nobody cares what order you do it in. You can do the skin first and then the catheter. You can do the catheter first and then the skin. Nobody cares. Okay? But while we're there cleaning the catheter, we also want to inspect the tubing and the bag, because catheters are going to be attached to some sort of a collection bag. So this is a catheter. See how floppy it is? It is soft and flexible, designed to move with the patient. It's not hard, rigid. It doesn't hurt, but I wouldn't call it comfortable either. And that's because this is designed to go into the urethra. Remember the urethra we talked about last week? It's the tube that goes from the bladder to the outside world. Its only job, it only has one job. Its only job is to hold the valve open. That's it. That is a catheter's only job. Remember that valve at the bottom of the bladder? It holds the valve open. And if it's holding the valve open, that means the urine comes right out through the tube. Well, that's not going to help us much if the urine comes right out through the tube and all over everything. So we're going to attach this to some sort of a collection device like a bag. It simply plugs in. That's it. So the catheter is inside the patient holding the valve open. The urine comes down through the catheter tubing into the drainage bag tubing and collects in the bag, and we empty the bag. CNAs do not separate these two pieces unless you've been trained to do so. Okay. We clean the catheter and the skin around it, and we empty the bag. Those are our roles. All right, so a couple parts here to show you. We have the catheter that's inside the patient, and that little tip of the catheter. I'm going to pass the catheter around in a minute so you guys can see. The little tip of the catheter has a hole in it, and that's where the urine is going to enter the catheter. A balloon is going to keep it in place. I'll show you that in a second. And then the catheter tubing. Down here, it's going to terminate in 2 ports. One of them is going to have a colored little area, and that's how we inflate and deflate that balloon. We just use water. The other port is what the drainage bag is going to plug into. So the drainage bag plugs into the port, and then we have drainage bag tubing that empties into the bag. The bag has markings on it. It has a port. That is how we enter or empty the urine out. And that port has a little house that it lives in to keep it nice and clean. Those are all the parts of the catheter and the bag together. So the catheter and the bag are 2 separate pieces, and that's because a catheter can stay in place for up to 30 days. So this is a catheter that's been inserted into a patient. Do you see this balloon? That is sitting right on top of that valve, and that's how it stays in place. We can tug on that a pretty good amount, and it's not going to come out. If I tug on it too hard, it will. So we want to try to avoid tugging on the catheter. But that balloon is simply going to keep that catheter in place. it's not inflated when we put it in. You can't shove a catheter up a urethra if a balloon is in place. So that balloon will actually be deflated. There won't be anything in it when we insert the catheter. Once we get it into the bladder, then we take water, sterile water, and we inject the sterile water into the balloon. Now it's inflated, and it acts as a doorstop. When it's time to take the catheter out, we simply take a syringe, pull that water out, and now the catheter literally slides right out. Okay? Make sense?
And CNAs are allowed to take out
No.
catheters. Okay.
I'm explaining how this is done for your knowledge so you understand what's going on the inside of the patient. CNAs can be trained to take catheters out in certain situations, but for the most part, it's not a CNA task, and you would never do it unless you have been trained to do it. Okay. So I'm going to pass this around so you can see how that works. Catheters can stay in place up to 30 days, but the bag is usually changed once a week. Again, you can be trained on how to change the bag, but it is not a CNA task out of the gate. Not every place will allow you to change the bag because, unfortunately, this is where most potential bacterial invasions occur, okay? There's a high rate of risk of infection when we're changing the bag out. So CNAs are responsible for cleaning the catheter and the skin around the catheter. We're responsible for emptying the bag and documenting output. You can be trained to change the bag, but that is an employer discretion. Okay. So this is our problem with catheters, and it's a big problem with catheters. When we have a catheter in place, do you remember me talking to you about pericare? I told you that bacteria are all trying to find a bladder to get into, that it's the ideal breeding ground for bacteria, warm, dark, moist, plus enzymes and proteins that allow it to procreate. You guys remember that? Well, what we've done when we put a catheter in place is we actually created a secret tunnel for those bacteria to climb up, and they never, ever, ever see our bouncers. And along the way, they procreate. Okay, they procreate. We're going to get to that. But infection control, I want to remind you how this works. Remember, when we have a pathogen, it has to have a place to live. It's got to have a doorway out, and then it's got to have a way of traveling around. Well, urine is a good medium. It's warm and it's wet, and it moves freely. So any bacteria that's in there could be a hazard. Then it's got to have a doorway in, and then we have to be susceptible to it. And our patients are usually pretty susceptible to new infections because their immune system is compromised. So what does that mean for us? It means that catheter-acquired urinary tract infections are a very real risk, and they kill about 2,500 people a year. So we don't use catheters unless we absolutely have to use a catheter. We don't use them for convenience. If our patient is incontinent, urine's coming out all by itself. Doesn't need us. Okay, we don't use catheters for convenience. So if you remember, urinary system review, we had 2 kidneys. Those kidneys filter blood how often? 9 to 5?
5?
What do you think? How often do the kidneys work?
Continually.
Oh, 24 hours a day, right? It's not a 9 to 5 job. So those kidneys filter blood, produce urine. That urine drips down tubes called ureters, and it collects in the bladder. Little valve at the bottom of the bladder keeps the urine in place until it's time to go to the bathroom. Valve opens, urine comes out. Everybody remember this? Okay. when we have a catheter, where's my catheter? When we have a catheter, the nurse will take a catheter, insert it up through the urethra, thread it up through the urethra until it gets into the bladder. And once it gets past the valve and into the bladder, the nurse will take sterile water. And inflate that balloon. And all that's going to do is hold that catheter in place. That's it. That's the whole process. Not nearly as scary as people think it is. Okay. But remember that when we have a catheter in place, that allows bacteria open entry. And that's what makes catheters so dangerous. So that catheter, once it's in place, is going to be attached to a collection bag of some sort. And that bag is going to be lower than the level of the patient's hips. Never above the patient's hips, because recycled urine is gross. You put the bag above the hips, the urine's going to go right back into the patient. I don't know about you, but that's pretty high on my gross meter. Urine should be a one-way trip. Okay. Now there's a couple different types of bags. We have bedside bags, which is what I have here for us to play with. It's a large bag, holds a lot of urine, hangs on the side of the bed. Useful when the patient is kind of stuck in one place. Okay. But this is not convenient if you're going to get up and walk around Winn-Dixie. You don't want to carry a suitcase of urine with you. That's just a little embarrassing. So if the patient is out in public, they would attach a smaller leg bag. A leg bag is small, easily concealed under clothing. It attaches with straps around the thigh or the calf, and it's just like this one, attached to the catheter, and the urine goes into the bag. And then the patient goes to the bathroom, opens the valve at the bottom, lets all the urine out, closes the valve, and goes about their daily business. There are people walking around our community with catheters right now, and you have no idea because their bags are concealed. So bedside bags used when a patient is pretty stationary. Leg bags are used when the patient needs to be more mobile or integrate into society. They're both cared for the same way. Okay. So it shows you how a leg bag would be used. It's going to attach to the thigh or the calf. The catheter is going to attach to the leg bag tubing, and it's just going to hold urine. Now, if we allow pathogens into the system, it's going to be a bad day for our patient because that urine is warm and it's moist. Now, it's not dark yet because the bag is clear, okay? But it's enough that our pathogens can procreate. A little slowly, but they can get the job done. And as they start to procreate, they climb. And as they get up here into the tubing, that urine gets fresher and warmer. And now they really ramp up production. And as they start to climb and get into the catheter, now we've got dark, warm, dark, moist, all-you-can-eat buffet. So they really get going. And when they climb out of this hole here into the bladder, it's not 1 or 2 bacteria that's invading. It's 1 or 2 trillion. And your patient can go from okay to really, really sick in the matter of hours because of a bacterial invasion that their body just does not have the resources to fight. And this is why catheters are so dangerous for our patients. Our job is to make sure that no bacteria gets to enter the system ever. So we've got to take this super seriously.
But I think we all have some type of bacteria in our bladder, right?
There's two different types of bacteria. There's, for lack of a better term, good bacteria and bad bacteria. That's not really a good term, but we're going to use it, okay? So there's beneficial bacteria, which helps get rid of bad bacteria and get rid of some of the. What's that?
What's in yogurt? Is there a bacteria?
Yogurt is a probiotic.
Okay, all right, sorry.
So yeah, it is, yes, yogurt has lots of different strains of probiotics. Lactobacillus is probably the most common, but that's going to work more in the gut flora than it does in the bladder.
Right, but it
is
one
a
of the
good
bacteria.
bacteria. Yes. Yes. So we do have some, but those aren't the ones that we're talking about here. Good bacteria, kind of like good guys, they're hard to find, right? Bad guys, dime a dozen. Okay. So we need to understand that the bad bacteria tend to procreate way more effectively. So there's 3 places that bacteria can enter this system. One is up here when the nurse puts the catheter in. If we aren't really careful and keep this sterile and pick up a couple bacteria, we're going to put them right into the bladder. That's no good. So this is a sterile process. Remember I said there's a difference between sterile and disinfected. This is a sterile process. Nurses have to study sterile process for about 3 to 4 months. How long are we here? Yeah, it's not us. We don't do sterile. So this isn't us. This is another place that bacteria can enter when we're changing the bag. Because if we allow this port to get contaminated in any way, we're allowing it entry directly into the catheter. So this is why you have to be trained to change out the bag. But this is the one that we are responsible for. Emptying the drainage bag every shift. If we don't do this properly and we contaminate that port, bacteria, or we leave the valve open, bacteria can enter the system. And yeah, it's a harder trip. They have to climb the bag. They got to climb the tubing. They got to climb the catheter. It's a harder trip. It's further away from the body, but it's still doable.
So, you might told this before, but let's suppose if you have a bag on your leg, how long can you use the same bag?
A week.
Ah.
Most bags are changed out once a week.
So you need to go to the hospital once a week for the nurse to
No.
change it?
No, the patient would be trained on how to change it.
Okay. Okay. So this is why we also can be changed how to change.
Right, you can be trained on how to
Yeah.
change it. Yes. But no, that's not something that has to be done in a hospital.
Oh.
Patients can, I train patients to do this all the time, to care for their own catheters. But they have to understand the risks involved and why it's super important that we keep everything super clean. You have to be trained.
Sorry if I ask a lot, but it's like my father, I'm doing this to take care of him. And he's 86, and last time he was wearing the catheter, he got bladder infection 3 times. I thought he would die. I told it's better you remove it and wear diapers. And he said, I'm going to wear diapers. So what are you going to do?
He'd rather have a catheter than a diaper. Bless his heart.
Yes, I don't
It's
like that, but I
50-50
had it
with
for 5
guys.
years.
No, I don't know what people are so hard-headed. And he got those infections. Told the infection will kill you. The diaper, not.
Well, you can still get an infection, can't you, with a
Yes.
diaper? Not changed often enough?
Diapers?
No, that,
Well, we call them adult briefs, not diapers.
Okay, but anyways.
But yes, remember they're holding in moisture. Urine is acidic in adults. You're holding acid right against the skin, blocking out air and light, so it's warm, dark, moist, and the acid can eat into the skin. So yes, skin problems, infections, rashes, sores can happen if they're not cleaned every 2 hours around the clock.
Keeping it
But there's a different type of catheter we'll talk about in a minute. So remember that when you empty the port, allowing any bacteria, or empty the bag, the urine through the port, allowing any bacteria in, is going to be detrimental to our patients. So we have to be aware of that. Bag should always be positioned on a non-moving part of the bed and always above the floor. You never want the bag to be laying on the floor because that's how it's going to pick up bacteria. We want the bag above the floor, but below the level of the patient's hips. Okay, below the level, because we don't want that urine to run back into the patient, because it's gross. Sometimes patients pull catheters out, especially if they're a little confused. I think somebody's in there. Sometimes patients will pull it out. If you notice a patient is tugging on the catheter, please report it to the nurse. Because as the nurse, I'm going to try to figure out if there's another option here. Pulling a catheter out can be a very painful experience because that balloon is still intact and it's going to rip some tissue on the way out. It will. You're going to see a little blood and it's going to sting like crazy when the patient pees. So we want to try to avoid that whenever possible. But if your patient does pull it out, there's some specific steps that we want to take. Now, patients pulling out a catheter is bad, but CNAs pull out way more catheters than patients do. And that's because if the tubing is coiled near the floor, your feet will get tangled up in it, and when you're walking by, you'll pull that catheter out. It's also very common when we're transferring patients from bed to wheelchair or into a chair. If that catheter doesn't go with you, you'll pull it out. If you get a patient up to walk them somewhere and they've got a catheter and it stays on the chair, you'll pull it out. CNAs pull out way more catheters than patients do. But probably the most common one is when we're turning a patient onto their side, because you will subconsciously lean against that bed with your legs, and if you trap the tubing there with your legs as you turn the patient, that catheter will come out. All of those are going to result in pain, a little blood, a lot of stinging, and some tears from both you and the patient.
Takes less time to stop and think about it than it does to replace everything and go
Yes.
through all of it.
Yes, a moment of assessment is worth a pound of cure. So CNA should always be aware of when a patient has a catheter so it doesn't accidentally get pulled out during routine activities. Yeah, this, I know it's a cartoon, but I have seen this happen way more times than I can count. I'll be walking down a hallway and I'll see a urine trail. I'll just see it. All right, somebody's catheter's out. Now we got to go find who it is. And usually it's a CNA that knew the catheter came out and tried to hide it. Yeah.
How do you hide it?
Don't report.
Yeah, you don't report it. You put it in the soiled utility room. Don't do that. We're going to talk about that in a minute. So if a catheter does get pulled out, put the catheter and drainage bag into a clean, empty trash bag or into a basin. Put it in the patient's bathroom. Now the reason is, as the nurse, I have to look at the catheter when it gets pulled out. A catheter like this, after it's pulled out, is not a problem for me. Problem for the patient, obviously, but not a problem for me because the whole balloon is intact. That means the whole thing came out. But if I look at the catheter and it looks like this, I've got a big problem because I'm going to pass this around. There is a piece missing. When this balloon burst on the way out, and this can happen with older catheters that have been in a while because the body attacks the latex that it's made out of. It's a foreign object. So it breaks down the integrity of the latex. And if this thing bursts on the way out and leaves a piece of itself behind, we can't leave that in the bladder. That means I've got to get a hold of the doctor and we've got to go fishing with a whole tube and camera and light and grapple system inside the bladder. It's no fun. But I can't just leave a piece of a catheter behind. So this I can deal with. This requires expert consultation. The only way for me to know which way to go is to look at the catheter. If you've hidden the catheter, if you put it in soiled utility room, I have no way of knowing what's going to happen to that patient.
So what happens when people are allergic to latex?
We have other types of catheters. We have silicone catheters that we can use.
Oh.
Yeah. So there are other options. Please make sure you report it to the nurse right away. Now there's a couple different types of catheters. The one that I'm passing around there is called an indwelling Foley catheter. This is what you're going to be tested on. It's also called a Foley cath because in healthcare, for whatever reason, why stick with one name when we can get two? Everything in healthcare has two names. I don't know why. It's just the way it is. But a Foley catheter is an indwelling catheter. Now this is good if we want to put the catheter in and leave it there. We're going to use the balloon as a doorstop to keep it in place. Works well. But if I don't want to leave the catheter there, if I just need to put it in real quick to get a sample and take it out right away, I'm going to use this. This is called a Red Robinson or an intermittent cath, or we got a third name for this one, a straight cath, because it has no balloon. A straight cath. So a straight cath is just put in for temporary use. We have to hold it in place. Like my hand cannot come off of it. Because this is like spaghetti. If I let go, it's going to come right out. There's nothing to hold it there. So when we're using an intermittent or straight cath, we put it in and hold it there while we empty the bladder, and then we take it right out. Okay? So this is called an intermittent or straight cath, also called a Red Robinson because it's red and apparently made by a guy named Robinson. Now, the third type of catheter down here, this is called a condom cath.
Oh, it's not the Texas cath.
Yep, also called a Texas cath. And an external cath or male cath. So we got 4 names for this one. So an external cath, a male cath, a condom cath, or a Texas catheter. You will hear it called all of those things. It looks suspiciously like a condom. It is sticky on the inside, so it adheres to the penile tissue. It is rolled over the penile tissue. And then we've got this little port that sticks out of the front that the bag attaches to. So this is an external catheter, nothing inside the patient, but it is often used instead of internal catheters with males because it directs the urine away from the body and collects it into a bag. So we have fewer overall skin issues. And it's easier to care for because we're not having to perform pericare every 2 hours if our patient is incontinent. So this is you're going to see this as a pretty common solution to male incontinence, but there's a problem with it. It's a very serious problem. When we have a Texas catheter in place, this little reservoir tip right here allows urine to kind of sit there, and it's going to sit right against the top part of the penis. That can actually, remember, adult urine is acidic. So that urine sitting there can actually eat into that very sensitive tissue. So this is usually going to be taken off every 3 days, and we've got to clean the area super well. I mean, really, really well. Make sure the area is nice and dry before we put a new one on. But we usually use a skin protectant on the skin at the head of the penis before we put one of these on to help provide an additional layer of protection to that skin so that the the urine, the acidic urine doesn't really eat into that skin very well, okay? So 3 different types of catheters. You do kind of need to understand that there are different types of catheters because we are going to be responsible for cleaning differently. In dwelling catheters, we clean the catheter and the skin around it because it stays in place. Red Robinsons or intermittent casts we're not involved with. Texas catheter are replaced every 3 days and require really good skin care and usually a protective application before we put a new one on.
So this Texas catheter is more like for a person that has urinary incontinence.
It's used for urinary incontinence, yes. Okay. That's why I was telling you, there's a different type of catheter that we were gonna talk about. Okay, so that would be something that you may want to discuss with his treatment team. All right, so when we're doing catheter care, this should look awfully familiar to you. We're gonna clean the peri area like we clean for peri care. We're gonna go down the middle, fold our leaf, down one side, fold the leaf, down the other side, fold the leaf, down the skin fold the leaf, down the skin fold. Same cleaning process. The only difference is we're gonna hold the catheter up out of the way as we clean those areas. So just hold it up. Cleaning the catheter, always wipe away from the urethra just like peri care, okay? When we're cleaning the catheter, we're gonna hold it in place so it doesn't pull on the inside of the patient. So we're gonna hold it in place, wrap the washcloth around and wipe away from the urethra, fold our leaf, hold, wipe away, fold our leaf, hold, wipe away, fold the leaf, hold, wipe away. Okay, leaves method.
And for men, same. You have to hold.
Same. Everything is the same.
So we're using all the leaves to wipe the.
So 5 for the front or for the peri area, 4 for the tubing.
Okay.
Whatever, it doesn't matter. There's no checkpoint. You could just do 1. But I want you to do 4 so we make sure we get any bacteria that could be on there really well. Okay, because remember that's a point of entry. So I want you to do 4 strokes.
So it's correct to say that women is more propense to get bladder infection on this catheter than a man, or?
Absolutely. Women are more at risk of bacterial infections, period, whether there's a catheter there or not, because our urethras are so short.
So when you do this, you don't wipe the behind, only the front?
What's the care plan say?
Right, what does the care plan say?
Sorry.
No.
That's a very good answer. What does the care plan say? Care plan said wipe catheter tubing and peri area only. So what are we going to do?
Do that only.
Right, follow the care plan.
Exactly.
Exactly. Yeah. So but let me answer your question because there's a question there. Okay. Why are we not washing the butt? Well, remember with peri care, our patient was laying on a wet pad, right? So their butt is in urine. You think we should wash it off? If there's urine on the butt?
Yes.
Sure. I don't want urine on my skin. Do you want urine on your skin? So we're going to wash the butt with peri care because it's laying on a wet pad.
Yeah.
This patient is not laying on a wet pad. Where's the wet?
And the drainage bank.
But
What's that called? I forgot.
Drainage bag.
maybe I'm being stupid here, but let's suppose this person made the number 2.
Okay. Well,
Isn't there bacteria there that needs to be cleaned?
well, sure. If the patient had a bowel movement, we would clean the backside.
But then it will be on the care plan.
Right. This care plan for the test tells us to clean the peri area and
Only.
catheter tubing only. So you're putting a scenario in there that doesn't exist for the test.
Okay, I understand.
But in a clinical setting, absolutely, if your patient had a bowel movement, we're going to clean whatever they have. So the care plan would say clean buttocks after bowel movements as needed, because we have no idea when they're going to have one. But this patient, we're focusing for the test on urine management.
Gotcha.
Okay, remember the test is one little scenario out of a huge possible amount of scenarios. It's giving you one scenario that you might find out there in the real world. Just one. You don't have to demonstrate all of them. It pulls one. Okay? And thank God for that. Right? What if we had to do every scenario we ever come across ever? The test would take forever.
Yeah.
Okay? So good?
Good.
The good point, or the important point here, is that we hold the catheter while we're cleaning it, because we don't want to pull on the inside. If you pull that catheter, it's going to hurt. Okay? Again, we're always going to follow the
Care plan.
So our care plan says provide catheter care with soap and water to a female resident with an indwelling urinary catheter. Clean the catheter tubing and perineal area only. So that's all we're going to clean is the catheter and the peri area. Okay? So every skill starts with the opening. Every opening starts. We need to get our barrier first before we get our supplies to have a clean place to put them. We're definitely going to use a privacy blanket because our patient is uncovered and undressed during this skill. We're going to, it's a washing skill, so we're going to get water. We're going to check it. They're going to check it. All of those steps that we've talked about. We are working with personal areas, so we definitely need some gloves. The first thing your gloves should touch is the patient. When we're putting a chucks under the patient, we're going to have to turn them on their side. What are we going to do before we turn them?
Scoot towards you.
Right? And we should always remain behind the patient's behind. Good. And we're going to put a chucks under the patient just in case we get a little drippy with those washcloths. We want to keep our sheets nice and dry. We're going to use that same rolling method of the privacy blanket that we used with peri-care. We're going to roll the gown up inside the blanket. And we're going to make sure that we cover the legs with a towel because of modesty. We're going to wring all of our washcloths out thoroughly. Remember, no drippy wet washcloths. And we're going to use the leaves method because we're washing genitals. We'll apply soap to all 5 leaves. We're going to hold the catheter up to clean our peri area. And we're going to use 5 strokes, always moving away from the urethra. Whenever we wash, we rinse the exact same way. And then we're going to pat dry top to bottom. You look perplexed.
Yes. The privacy, we're rolling it up with the gown
Right?
to do the peri-care.
Right?
What's on their knees?
Towel.
Thank you.
What?
Towel.
Mm.
A towel.
Stupid for a minute.
No, you're fine. So again, we're going to wring those washcloths out thoroughly. When we do the catheter portion, we'll apply soap to 4 leaves this time. 5 for peri area, 4 for the catheter. And we'll clean the catheter tubing away from the urethra. We're going to use those leaves method. Whatever we wash, we rinse the exact same way. And then we'll pat the tubing dry. We're going to cover them back up and then scoot and roll to get them on their side so we can take that chucks out from under them. Turn them back to the center of the bed and cover them with a privacy blanket. You're going to want to take the privacy blanket off at this point. We can't because we have gloves on and we need those gloves to take care of all of our supplies. This is the hardest step for you guys. I'm telling you out of experience. remember, when we have a privacy blanket, it doesn't come off until the end of the skill after everything has been stored, put away, put in dirty linen, your environment is clean, and you've removed your gloves. This is the hardest step for you. When you get them covered with that privacy blanket, you've got to leave it alone. Okay, and you'll see what I mean when you start practicing this. We'll dispose of all of our linens. We're going to clean and store our basin and then remove our gloves. Once we removed our gloves, then we can remove the privacy blanket. Perform all of our actions and do our closing, and that's it.
Where am I putting my dirty washcloth and stuff?
So there's going to be a hamper like this.
During the bed bath? During pericare?
Yep. On the table is fine.
On the barrier, okay.
On the barrier.
Thank you.
Yep. At the end, you'll put them in a hamper or a basket, whatever your facility has.
During the bed bath, we can put it on the barrier.
Right.
Alright.
Whether it's bed bath, pericare, catheter care, doesn't matter. Not on the table itself, has to be on the barrier.
Barrier, we're good, okay.
Yeah.
I'm overthinking stuff.
Yeah. Common, very common. All right, so, whoops. Where am I? Okay, so let's go. I'm going to show you that video in just a minute. I'm going to show you the last two videos one after another, okay? But I want to go through the instruction for this first. So drainage bag, again, you already know all the steps to this. Guys, they give you, I think it's 9 minutes to get this done. Yeah, 9 minutes. That's an insane amount of time. You do not need, it takes me like 3 minutes. You do not need 9 minutes to do this. All we're doing is emptying the urine from this bag into this cup, taking it to our bathroom, measuring it, dumping it, rinsing, drying, and storing it, doing our closing, and writing it down. That's it. Whole thing takes like 3 minutes. Why they give you 9, I don't know. Not a hard skill. This is called a triangular, makes sense, graduate, because it has graduating markings, container. Triangular graduate container. Most people call it a urine cup. But it is different from a urine cup because a urine cup usually is the small squat thing that you pee into for samples. So if you call it a urine cup, it can get a little bit confusing. This really should be a triangular graduate container. Try not to call it a urine cup because it can get confusing. It's actually not the right name for it. Okay, good. These markings are marked in ounces and cc's. As CNAs, what do we use? Ounces or cc's?
CC's.
cc's, correct. Okay, so if you go to page 165, let's read the care plan at the top of the page. It tells us to empty the resident's urinary drainage bag into a graduate container and measure and record urinary output in mLs or cc's on the intake and output form. It also gives you the form in the middle of the page. We're going to round to the nearest line. And for the test, you can be off by 50 cc's in either direction. Guys, they give you a 100 cc margin of error. That is huge. Huge. This is not about accuracy. It's all about infection control. Okay? Now remember we talked about 2 different types of bags? You guys remember that? We have the bedside bag and we have the leg bag. Right, for people that are out and about. Both of them have emptying ports. That's how we're going to empty the bag. When we empty the bag, we want to put, bless you, we want to put a barrier on the floor so that we're not putting the urine cup directly on the floor because, ooh, right? We want a barrier on the floor. We're going to put our cup on the barrier.
Now, barrier can be a paper towel?
Barrier can be anything, but for the test, we're gonna use a chucks.
Okay.
Yeah, we're gonna use a very specific type of barrier.
So I have a question about that. She brought up paper towel. So would you want to use a paper towel as a barrier? What if you spill urine?
You can,
Okay.
I mean, technically you can.
Okay.
And I say that because you're gonna see that in a clinical setting a lot.
Okay.
That's what I used on the last day.
Yeah, and that's probably the most common thing that we use in a clinical setting is a paper towel,
Okay.
because chucks are expensive and not always easy to come by.
Okay. Thank you.
So now I'm going to show you a process though with the chucks that I would prefer. If it were me, if I ran the world, you would use a chucks, and I'm going to show you why. But in clinical settings, you're going to see paper towels used quite a bit.
Okay.
Let me show you why a chucks is better and why we're going to use a chucks for the test. Okay, when we empty the bag, the emptying port can't touch anything. Nothing. It can't touch your gloves, the bed, the container, the barrier, nothing. Absolutely nothing. You need to know that principle. This is what they're grading you on for this skill. This is exactly what they're grading you on for this skill. Because if we let that port touch anything, bacteria gets into the bag, it procreates, it climbs the tubing, it climbs the catheter, it gets in the bladder, and now we've got a UTI. Okay, so super important. So to open the T-valve, so this is our bag here. This is your valve. Now, there's lots of different valves. There's lots of different bags. It's kind of like cars. They all kind of work the same way, right? But you have to get used to your particular car. Everyone's just you get in, you turn it on, you put it in gear, and you go. I mean, the mechanics are pretty much the same, but how they make that happen is a little different, right? Same thing with bags. Everyone is just a little bit different. But they all have an emptying port of some sort. This port is going to live in a little house of some sort. When you take this out of its house, this part right here cannot touch anything. This port right there can't touch anything. But you have to open the valve. This is a T valve. It kind of looks like a T. You simply slide it to the side and it opens. You can probably see into there. If you slide it close, it closes the port. Okay? So this lives in its little house. When I'm ready to empty it, I take it out of its house. Don't touch the port. I'm going to open the valve. Notice when I open it, I'm not touching down here. The number one error that students make is they do something like this. Why is this wrong? Why can't I do that?
Because you're touching the port.
Touching the port, right. So you've got to practice with this to get good at opening it without touching the end of the port. We're going to hold it over our cup, position the bag however we need to get the urine out. It's not Folgers. It's not good to the last drop. You don't have to get every single drop out, but do your best. Once you get it empty, make sure you close the valve. Important. Before you put it back in its house. And when you put it back in its house, you want to just slide it right in. Very clean. Don't do this. Okay, we don't want to do that. We want a very clean, slide it right into its house. Good? Okay. Okay. So when we measure this, we cannot measure it when it's on the floor underneath our bag. Because this has to be measured in a very specific way. It has to be measured on a barrier, on a flat surface, and at eye level. All three of those are on one checkpoint. So if you don't have it on a barrier, you don't get credit for any of it. If you aren't measuring it on a flat surface, you don't get credit for any of it. If you aren't down at eye level, you don't get credit for any of it. All three of these are on one checkpoint. You miss even a small part of it, you don't get any of it. So super important. That means that we've got to take this over to our bathroom and put it on a flat surface like the lid of the toilet. Okay? Now, if we're going to take this somewhere, I don't have it here. Are we allowed to carry open containers of urine through a room? We talked about that with bedpan. We can't take open containers of urine through a room. So if we got that chucks, this is why it's better to use a chucks. If we have that chucks, I can wrap the chucks around the container, take it over to my bathroom, and now I'm not carrying an open container of urine through the room. That's why chucks is better than paper towels. We're going to put the whole thing on the lid of the toilet, unwrap it. We're going to get down at eye level to measure it. And when we measure it, we want around to the nearest line. Doesn't matter whether it's up or down, just whatever the nearest line is. So I'm going to pass this around for you guys to take a look. So if you look here at this container, you can see that the urine is right under the line for 450. So we would round to the nearest line. So how much urine is in this container? 450. Yeah, 450. It's not 16 ounces because we don't measure in ounces. Our care plan specifically said cc's or mLs, so we have to use this side. Okay.
1 ounce equals 30 c.
30 mLs, 30 cc's, yeah.
So one side is ounces and the other one is.
No, the black, one side is just clear, the other side is in black. So look at the side in black so you can read it. On one side of the black markings is ounces, the other side of the black markings is cc's.
Oh, okay. And what is the white one for? I'm curious.
It just, that's how they used to come, and you used to have to try to read that. And then they decided to print it in black to make it easier for us old people.
Ah. Yeah. Good idea.
The ones with the black printing are more expensive.
Of course they are.
But
So they're
old eyes can't see that.
So they're gonna have one for testing. They're gonna have one with
with
black.
black markings, yes.
Okay.
Yeah.
So when we look there, okay, it's 450. Then we memorize that to later on.
Right, because we have to dump it. Where are we going to dump this? It's urine.
In the toilet.
In the toilet. We're going to rinse it. Where do we dump the rinse water? It was urine. In the toilet. And then we're going to dry it and we're going to put it away. After we do that, we'll do our closing. Make sure that you're looking, when you're emptying that bag, make sure you're looking at the tubing. It's not coiled near the floor. The patient's not laying on it. It's not kinked. Take a look at it. And we'll set it down, measure it at eye level, empty it, rinse it, dump the rinse water in the toilet, put it away, do our closing. Thank you very much.
Go ahead.
Thank you very much, Ms. Jones. Is there anything else I need for you? All of that. We're going to wash our hands, document, because this is a documentation skill. And then what do we have to do after we document? Wash our hands again. Let's talk about documentation. It's right here. You're going to document on the intake and output sheet. What is urine, intake or output? I hope so. I don't want to be the one making an intake. So, on this form is a place for intake and a place for output. Where do we need to document? If you accidentally document up here, that is a big deal because we are saying in a legal record, that this person drank 450 cc's of urine. Now, we find that funny Do you think the lawyer has a sense of humor?
Jaco does?
No. There is no sense of humor in a courtroom. Now, the real problem here is that court cases do not happen right away. If your patient has an issue and sues, that you won't be deposed on this. You won't be in front of a lawyer for 4 to 6 years. Do you think you're going to remember what you were doing on a certain Tuesday afternoon 4 to 6 years ago when the lawyer is looking at you saying, hey, you're telling me this guy drank 450 cc's of urine on this day at this time? And you're going to go, well, of course he didn't. And he's going to go, really? You remember that? You remember where you were on a Tuesday afternoon 4 years ago, and you can tell me that this guy didn't drink urine because your documentation said he did. That is how that deposition is going to go. When I tell you they do not have a sense of humor, I mean they do not have a sense of humor anywhere. So we've got to be really, really careful about this. So during the test, if you document under intake, it can fail you. Because you are saying, as God is my witness, that's what this person did.
Does that also go for if you don't document it, it didn't happen?
Absolutely.
Okay.
Absolutely. 100%. Because that lawyer has no sense of humor. And if you say, well, of course I did it. Of course I changed or emptied this guy's drainage bag. I did it at the end of every shift with every patient. I never failed to do it. That lawyer is going to say, you didn't write it down. How do I know you did it? I can't take your word for that. How much urine was in that bag? If you remember this that correctly, you remember a Tuesday afternoon 4 years ago, how much urine was it? That's how depositions go. They're not nice, guys. They are not nice.
But in this case, the nursing assistant is the one that goes to court, or the nursing?
Well, if you're the one that wrote it,
It's on you.
it's going to be on you.
Ugh,
Because what did our care plan tell us to do?
follow the curve.
Our care plan told us to document on the intake and output form. If we didn't document, then who's on the line? Us.
Wow, so it actually says.
Yeah, you're going to initial.
I was just gonna, that was my next question. Thank
What?
you. That was my next question.
What was the question?
Well, documenting, when you do that, you have to either initial or
Yes.
sign, do you not?
Right. Yep. And you can see here. We have
Oh.
initials,
Okay.
and down here we have signature.
Oh, so this is complicated actually.
No,
It's not complicated.
No.
But it is legal.
But if, let's suppose the way I've been through all hospitals with my dad, and the way they come in and go, they are in turn on and turn off mode only. I don't think they do all that. I'm gonna start paying attention now after taking these classes, but it's like sometimes they have no time for nothing. They come in, they throw things around and this and that, and it's like they have tons of things to do.
They do.
It's very easy actually to forget stuff.
Well, you
Because
There's something in
they're
their
probably
pocket that
taking
they
care of,
document.
I don't know how
90% of
many
them
at the same
document.
time. So
Put them down.
I kind of feel sorry for them.
Okay, so let me, there's a couple things there that I want to unpack real quick, okay? So first of all, you're new, right? You're still learning. So right now, everything to you is very overwhelming and takes you a very long time to do because you're new, and that's appropriate because you're new. For me to empty the drainage bag, less than 3 minutes. And you're probably not going to see me document because I'm going out into the hallway on my computer because all documentation now is electronic. So I'm going to go out to the hallway on the computer, sign in real quick, put 450, sign out and walk away, go take care of another patient. You wouldn't see that aspect of what I do because it's done in a different place. You're also not going to see a lot of what I do because I make it look easy and you don't see. In here, I exaggerate everything because I'm teaching. But in a clinical setting, I'm going to be going for economy of movement. I'm going to do as much as I can, as quick as I can in a confined space. You're probably not going to catch all the details because I'm not new. Make sense? So you're looking at this from a new person's view, but you're watching somebody perform it who's not new. So you're going to see some things that are different because you're exaggerating everything because you're still learning. Make sense?
Mm-hmm.
So think about learning to drive. When you learn to drive, you probably made a ton of mistakes. And it took you a while. You had to pay really close attention to what you were doing. Probably didn't have the radio up loud. You had to focus on what you're doing. Now, you can probably drive halfway across the town and not even think about what you're doing. I mean, you're like, oh, I'm here already. You know, your brain isn't really engaged. How do you get from having to pay super, super, super close attention to every step to not having to think about it? Practice, that's right. So the more experience you get, the different the skill is going to look from the outside. Does that make sense? Okay, so that's the first thing I had to go over. The second thing I have to go over is, yeah, not everybody out there is going to do it the way I'm showing you in here because they're taking shortcuts and they're making things up as they go and they're not always doing everything the right way because humans are humans, and if there isn't good oversight, you guys are going to make up your own rules. I try to fight against that. This is why I show you the right way and I explain why it needs to be done the right way so you're less likely to be corrupted when you're out there. But is everybody out there going to do it the right way? No. They don't. I wish they did. But not everybody is conscientious. Okay? Now, short-staffed? Yeah, everybody's short-staffed. Absolutely. There's no argument about that. That's going to affect the way that you work. But I'm going to tell you that you guys are a big key to whether you stay short-staffed. If you go home and you complain to everybody that you can think of, everybody in your orbit about how horrible your job is. I hate my job. There's never enough people. Everybody always calls off. I hate. Do you think anybody's going to want to become a CNA? And if nobody wants to become a CNA, we're going to work short staff for the rest of our lives because we're not actively recruiting. Instead, if you go home and say, yeah, today was a horrible day because we were short staffed, I really wish that other people would join and become CNAs. Can you imagine how incredible it would be if I had a whole bunch of people like me working with me to take care of my patients? Two totally different mindsets. One of them is going to promote my industry to others and make it attractive for them to join. The other one is going to push everybody away. So we have a certain amount of responsibility in how we portray our industry. Does that make sense? And that's a trap a lot of CNAs fall into. And it's sad because we're never going to get out of this shortage if we're too busy talking about how horrible our job is.
Quick question. So are we allowed to carry like a small notebook?
Depends on your facility.
Okay.
Because a lot of this is going to be patient confidentiality.
Oh.
And
okay.
Everybody's going to have a policy and procedure on this.
Okay.
Some facilities will let you write it down in a notebook as long as you destroy the notes before you leave for the day.
Okay.
Other places are like, no, you do it, you document it at that time.
Okay.
Because the problem is, and I've seen this happen, we've got a little notebook, we write it down, we put it in our pocket, and then we go about our day, and at the end of the day, we go home and we realize, oh, I didn't document this.
Okay. The reason I ask is because when I was a CMA, we had a piece of paper and it was just the room number. It was nobody's name.
Right.
And so we would document on that. And then, you know, when we were done doing what we needed to do, we would go and sit and chart.
Yes.
Every,
That's
yeah,
the way I remember.
Oh, okay. I
Yeah.
didn't know
Every-
because you're saying everything's going electronic, so I wasn't
Right.
sure if that would help or not.
and every facility is
It's
going to be
different.
different.
Okay, that
And
makes
this is the
sense.
reason, okay, because electronic charting probably came on after you were
Yeah.
a CNA.
Yeah.
All charting now has to be done electronically. Well,
Oh.
remember when you log in and you chart, it's actually time stamping when you chart.
Oh.
So a lot of facilities, because of that, a lot of facilities need you to document at the time it was actually
Gotcha.
performed because of that time stamp.
Okay.
This is why every facility is going to have their own policies in place depending on the technology that they're
Gotcha.
using.
Okay. Thank you.
Good? Questions? All right, so I'm gonna show you these two videos, one right after the other. So first we're going to watch the catheter care video, and then we're gonna watch drainage bag video. And that'll be it for skills. We've now gotten all the skills under our belt. Isn't that amazing? You guys did a great job. So let me go ahead and, yeah, go ahead. Catheter care. Hi, Miss Jones. My name is Patti. I'm your CNA today. How are you? Good. I need to do catheter care. Is that okay? I'm going to close your curtain, wash my hands, get my supplies, and I'll be right back. Okay, Miss Jones, I'm going to gather my supplies. I'll start out with a barrier that provides a clean place to put my supplies. And we're going to get 4 washcloths, a towel, a chucks, a privacy blanket, and now I'll gather my basin and soap. And a set of gloves. All right, Miss Jones, I'll just get some water. I'll be right back. Okay, would you like to check the water temperature and make sure it's okay? It's good? Good. I'll place the washcloths in there to stay warm. And I'm going to cover you with a privacy blanket. This is going to help protect your privacy and keep you warm while we do this skill. And I'm going to pull your sheet down to about your knees. Okay, Miss Jones, I'm going to place this pad underneath you. This is going to help keep your bed dry while we do this skill. First, I'll roll it toward me. And place it on the bed. And then I'll put my gloves on. All right, Miss Jones, can you scoot toward me, please? Thank you. And can you roll onto your left side? 1, 2, 3. Thank you. I'm going to be very careful, making sure that the catheter tubing rolls with the patient and doesn't get pulled on. I'm going to unroll the chucks underneath the patient's hip and have the patient come back onto their back, making sure that they don't lay on that catheter tubing. Miss Jones, can you scoot to the middle of the bed, please? Thank you. Miss Jones, can you scoot toward me? Thank you, and roll up onto your right side. 1, 2, 3. And now I can unroll the chucks to protect the bed. Come on back, Miss Jones, and scoot to the middle of the bed. Thank you very much. Okay, now I'm going to start cleaning the catheter. I'm going to roll your gown up inside the blanket. I will be exposing you, but we'll make this as brief as possible. Please let me know if you're uncomfortable. As I roll the gown in the blanket, I want to make sure that I don't grab the catheter, that we don't cause any unnecessary pulling or stress on that catheter. And now we'll cover her thighs with a towel. This exposes only the area that we're working on. I'm going to take the first washcloth and wring it out and apply soap to 4 leaves. 1, 2, 3, 4. Now I'm going to clean your catheter. I'm going to hold the catheter where it exits the body, wrap the washcloth around, and wipe away from the body. Fold that leaf over. I'm going to hold it, wrap the washcloth around, and wipe away from the body. That's 2. We're going to do this 2 more times. Away from the body. 3. And the last one. 4. I'll set this washcloth aside. Whenever we wash, we must rinse. So I'll wring this washcloth out, and we'll use it to rinse that catheter the same way we washed. I'm going to hold it where it exits the body, wrap the washcloth around, and wipe away from the body. We'll do this 4 times. 2, 3, and 4. Set this aside. Now we'll dry the catheter. Now we're going to do peri-care. We'll take a washcloth out of the basin, wring it out really well, and we're going to soap 5 corners. 1, 2, 3, 4, and the back side is 5. Okay, now I'm going to clean the peri area. I'm going to lift the catheter up out of the way with my pinky and hold the labia open while I clean down the center with the first leaf, always going top to bottom. And then we'll remove the washcloth and fold that leaf over. Now I'm going to clean down one side of the labia, top to bottom, fold that leaf over, clean down the other side of the labia, top to bottom, fold that leaf over. I'm going to clean the skin fold between the groin and the leg, fold that leaf over, and clean the other skin fold between the groin and the leg, and then set that washcloth aside. I'm going to take the final washcloth and wring it out really well, and we're going to rinse all of those areas the same way that we washed them. So I'll hold that catheter out of the way and spread the labia open, cleaning down the center, top to bottom. Fold that leaf over, clean down one side of the labia, fold that leaf over, rinse down the other side of the labia, fold that leaf over. We're going to rinse the skin fold, fold that leaf over, and the other skin fold. Set that aside. Now we'll dry gently by patting dry top to bottom and then removing the towel. Ms. Jones, I'm going to cover you back up. I'll unroll that blanket, which will replace the gown over the patient. I'm going to make sure that the catheter and the tubing is coiled on the bed, not near the floor and not where the patient is laying on it, making sure it's not kinked. Ms. Jones, I'll be right back. I need to dispose of your supplies. The towels and washcloth will be placed in dirty linen. The basin is going to be cleaned the way we clean everything else.
Remember, just both water and no soil washcloth, just like We'll return the basin to the drawer, and on the way we'll pick up the soap. We'll
open the drawer with the paper towel and return the basin to its storage area. Now I'll dispose of my paper towels. Okay, Miss Jones, I need to remove the chucks from under you. Can I get you to scoot toward me, please? Thank you. And can I get you to roll up on your left side? 1, 2, 3. Thank you. I'll roll this soiled chucks toward the patient and tuck it under her hip. Come on back, Miss Jones. And scoot back to the middle, making sure the patient is not laying on that catheter tubing. Okay, Miss Jones, can you scoot toward me again, please? Thank you. And roll up on your right side. And I'm going to remove that chucks from the bed. Okay, you can scoot back to the middle. Thank you. This is going to be thrown away. Okay, Miss Jones, let me just look at your catheter one last time. Make sure that the catheter tubing is coiled on the bed, that the catheter is not on the floor. Everything looks good. I'm going to remove the chucks from the table, and we're going to throw this away, and then I'll remove my gloves. We'll throw those away. Okay, Miss Jones, I'll pull your sheet up now. And I'll remove the blanket as I do so, rolling it into a ball. You put this in dirty linen. Okay, Miss Jones, here's your call light. If you should need anything, just let me know. Are you comfortable? Can I get you anything while I'm here, like a magazine? I'm just going to open your curtain and wash my hands. After washing my hands, I'll think about the steps in my skill, make any corrections that need to be made, and then tell the evaluator my skill is done. Nothing. Hello, Miss Jones. My name is Patti. I'm your CNA today. How are you? Great. I need to empty your urinary drainage bag. Is that okay? Okay, I'm going to close your curtain, wash my hands, get my supplies, and I'll be right back. For this skill, I'll need a barrier, which I'll place on the floor under the drainage bag. I'm going to need a set of gloves. And I'm going to need a triangular graduate container. I want to inspect the catheter tubing to make sure that it's coiled on the bed and the patient isn't lying on it and it's not kinked, but also that it's not hanging near the floor where somebody might get their feet tangled up in it and trip or accidentally rip the catheter out. This catheter looks like it's in the appropriate position. We'll now remove the port from its protective sleeve on the bag. Sliding the valve to the side will open the port. We can now position this open port over the graduated container and tilt the bag slightly to the side to allow the contents to drain into the graduated container. While doing so, we want to be careful not to allow that port to touch any other surface. Once the urine bag has been emptied, we'll slide the port back to the side to close it and very carefully insert it back into its protective sleeve. We want to make sure that the bag is hanging on a non-movable part of the bed and it's not touching the floor. We can now fold the chucks over the graduate container for safe and secure transport to the patient's bathroom. Once we're at the patient's bathroom, we're going to set the graduate container down on a barrier on a flat surface and position it so that we can read it. We need to be at eye level, and we're going to round to the nearest line, either up or down. You can see that the urine in this container is nearest to the mark of 425, So the amount that we will document is 425 milliliters, or cc's. Once we've measured it on a barrier on a flat surface at eye level, we can now empty the urinary graduate container. We'll throw the barrier away, open up the toilet, and we're going to dump the contents of the graduate container into the toilet. Now we're going to rinse the graduate container. We'll deposit the rinse water into the toilet as well. Now we can clean. After dumping the rinse water into the toilet, we'll set it down, use a paper towel to pick it up, paper towel to dry the outside, a paper towel to dry the inside, and we'll discard this, and then one for the drawer. We're going to place the graduate container in the bottom drawer and close the drawer with a paper towel. Okay, now I'll throw the paper towels away and remove my gloves. We'll throw those away as well. Thank you very much, Miss Jones. Is there anything else I can get for you while I'm here? A magazine, perhaps? You have your call light there. If you should need anything at all, please feel free to let me know. I'm going to open your curtain, wash my hands, and document my skill. Thank you. After washing my hands, I'll document on the intake and output sheet that the evaluator gives me. I'm going to document the time of output, the type of output, which is urine, the amount of output in cc's, and my initials. After documenting, I'll review the steps of my skill, make any corrections, and then tell the evaluator my skill is done. All right.
Now, if we was to get that skill, they'll have the mannequin set up with the drainage.
They will, and if you notice that the urine was yellow in the bag, it's actually water, but they're going to tint it yellow. Because if they kept it clear, it would be really hard to read. So they do tint it yellow with food coloring to make it a little more realistic, easier to read. Any questions? Congratulations, you guys are all done with the skills. You did a great job. Any final questions on anything? It's a lot. Look how far you've come in 4 weeks. So Wednesday, when you come to class, I need you to bring your yellow book back. White book is yours forever, but the yellow book you will be returning to us. We've got a lot of stuff to go over on Wednesday about employability, retaining your certification, continuing education, what to do if you want to move out of state, lots of things to cover. And you will get a graduation folder from me as well to get you started on the next segments of your career. You can take the practice test in your book on page 191 after you read chapter 10 and see how you do. If you want to take it before you come to class on Wednesday, you are free to ask me any questions that you want about anything you missed. If you want to wait until after graduation, that's fine too. The answers are in the back of the book. And you also have the free ebook that you can download for the written test as well. And I've got a practice test on the website too if you want extra questions. And the online program has literally hundreds of questions in it as well. So you've got lots of learning opportunities still. So I'm going to go ahead and pass out your review sheets for today. Remember, if you're completing those review sheets, when you go to test, it becomes a very easy way of reviewing all of the important information right before you go into test. So I just started doing these a couple of months ago, and the students said that they have been very valuable when it comes to the test day because it really condenses everything down into something that's easy to review right before you go into test. Okay?
The right here on top of the.
Right here, right there. Thanks.
Yep. There we go. So do you want to do
Thank you.
You're welcome. Remember that I do have a CPR class on Saturday.
Can you help me today?
Oh, thank you.
Yeah.
Oh, my background is done.
Okay. Yep, we do have a CPR class on Saturday if you're interested. It starts at 9 a.m. Just show up, and the cost will for you guys will be $55 now that you'll be graduating on Wednesday. All right, YouTube world, thanks for joining. We will see you on Wednesday, hopefully. And remember that I do not have another class session through the holidays. Next one will start in January. So we're going to have a little bit of a hiatus for about a little more than a month. I've got some really big projects I'm working on. Go check out cherokee-scrubs.com/quiz. Cherokee-scrubs.com. Can you put it up, Caitlin? It's in comments. Cherokee-scrubs.com/quiz. And if you guys could beta test it for me, let me know what you think about it. Is it easy? Does it help? There we go. Yay. Is it easy? Does it help? Let me know your feedbacks. Let me know if I'm on the right track. And other than that, we'll see you on Wednesday. Until next time, happy caregiving. Bye.